This episode of the Jerry Paul Podcast is CME eligible.
To claim credit, please go to the CME tab on jerrypal.org.
Welcome to the Jerry Paul Podcast. This is Eric Wadera.
This is Alex Smith.
And Alex, who do we have with us today?
We have some terrific guests today. We're delighted to welcome back Theresa Allison, who is a geriatrician researcher and professor of medicine at UCSF in the Division of Geriatrics. And Theresa studies music for people with dementia and their caregivers. Theresa, welcome back to the Jerry Paul Podcast.
Thank you.
And we're delighted to welcome Jenny Chen, who is a palliative care fellow at Yale. Jenny reached out to us because she plays music regularly for her patients. And she said, you should do a podcast about music. And we said, hey, we're recording one. Come join us. And so we're delighted to have you here, Jenny.
Thank you for having me.
And we're delighted to welcome Tyler Jorgensen, who's a palliative care doc, emergency medicine doc at the University of Texas, Austin. He podcasts at My Medical Mixtape, which is only available on Spotify. And I was fortunate to record an episode of My Medical Mixtape with Tyler at the... Which meeting were we at, Tyler?
We were in Denver. Yeah, AHPM. That's right.
AHPM. Yes. So check that episode out. Check all the episodes out. It's a terrific podcast. Tyler,
we'll have
welcome to
links to that on our show notes. Welcome, Tyler.
Alex and Eric, thank you so much. Psyched to be here.
So we got a podcast on music and medicine. And Tyler, before we jump into that, I think you have a song request for Alex.
I sure do. Alex, can you hit us up with Do You Realize by the Flaming Lips?
Tyler, why'd you choose this song?
Okay. When we started doing more music stuff for our patients in the hospital, a lot of people started to think, what would I want to listen to? And I had a team member say to me, my final vinyl, if I have like a final musical request, would be the song Do You Realize by the Flaming Lips. And so this is a shout out to our inpatient palliative team at Dell Medical School.
That's awesome. Maybe at the end of the podcast, we can all have our final vinyl. Alex.
Do you realize that you have the most beautiful face? Do you realize we're floating in space? Do you realize that happiness makes you cry? Do you realize that everyone you know someday will die? And instead of saying all of your goodbyes, let them know you realize that life goes fast. It's hard to make the good things last. You realize the sun doesn't go down. It's just an illusion caused by the world spinning round.
Dang.
Woo!
Oh, that was lovely.
A fun choice, Tyler. Thank you.
Thank you, Alex. That was awesome.
That was fantastic. So we got a lot to talk about on this podcast. Man, I could spend like an hour just on that song itself. That is. But Jenny, I'm going to start off with you. You emailed me about doing a podcast on music and medicine. I'm wondering, why did you think it was a good idea to do this podcast?
Good question. So I actually was doing a grand rounds as my final presentation here at Yale for my fellowship on the role of music in hospice and palliative medicine. And I was looking for articles and I wasn't seeing as many as I expected. And then naturally I went to my podcast, which is the Jerry Paul podcast, and I looked up, like, is there music in medicine?
There was even less on the Jerry Paul podcast.
Yeah. Like the last article was like 10 years ago. So I thought, why don't I email them? I just met you guys at the AHPM conference and I was like, maybe I can say, hey, I met you guys. remember me? Do you want to do something about music?
And I got to ask, because in that email, you said you were introduced to palliative care through music. How was that the case?
Yeah. So when I was a college student at UC Berkeley, I was pre-med. I was figuring out ways to combine my interest in music and medicine. So I actually volunteered at UCSF's Music is Good Medicine program, which was 10, 15 years ago. And I followed one of the amazing chaplains, Peggy. I don't know if she's still there, but shout out to Peggy. And I performed for many palliative patients. And that's when I started to understand, wow, I feel like there's something that I could do with music for these patients. And that's how I learned more about the specialty.
Great. Thank you for that.
And Tyler, I think when I was on your podcast, did I tell you the story about my grand rounds when I was a palliative care fellow?
Yes, you did.
Yeah, so
I think the title of it was "Get That Harp Out of My Face."
That's right. If I'm dying, get that harp away from me. That was the title of my final talk when I was doing palliative care fellowship. So we did very.
That is not your final vinyl. Will not be a harp.
It won't be a harp. Yeah.
And I had some people from the Berkeley School of Music came and performed at that grand rounds, and they did this really haunting melody with like a giant music bowl, you know, those things that you rub the edge of, and it just makes this haunting noise. But this was humongous. And we were in the MGH at this big, like, old amphitheater where they discovered anesthesia, and it just rang the whole place like a bell. It was amazing.
That's actually really funny that you performed or you had someone perform at the end, because I also did that too for my grand rounds. I asked my friend who's a music therapist at Yale, and we performed a song together that we've performed for a patient who is at end of life. So,
Oh, I gotta ask, which song?
we played Shooting Star by Howdy. This was my patient's favorite song, and I asked her what it was right before the day of performing for her, and then surprised her with the song. So she was very surprised.
And Jenny, you sing in front of patients during your fellowship?
Yes. Luckily, my program director, Dr. Morrison, lets me do that.
That's incredible. Oh my gosh.
Yeah.
How do you bring that up? Hey, can I
That's a good
sing for
question.
you?
No, I actually have been doing it where if it's a patient that I've been seeing every single day and I know they're about to leave, I secretly ask them, what's your favorite song? And then the next day I say, hey, you know that favorite song you told me about? I learned it within the last 24 hours. It's not that great, but here you go.
You're like Alex on the JFL podcast.
Yeah, totally.
Yes.
Oh, that's awesome. Tyler, you do something you don't sing, right? You actually bring in music to people's rooms. I read
we sang together on your podcast. It's not true that Tyler doesn't sing.
Oh, really? Okay.
Alex, you're very generous. Alex put me to the test right away. He was like, hey, Tyler, we're going to talk about music. Why don't you sing with me in the middle of this conference in Denver? And he opened up his guitar case like we were hoping people to, drop change in there. And was just like, come on, we're singing. It's like, okay, I guess we're singing. So, Jenny, you are so brave, and that's so beautiful. I rely on recorded music for my patients mostly. And I think that's based on my singing. I think that's more palliative than me just
not
singing.
true. By the way.
No, my
Tyler's
voice
a great
is nothing
singer.
special. I sing with the patients all the time, and we have so much fun because they feel safe joining in.
I love that.
They don't have a brilliant trained voice. I'm an instrumentalist. So especially
you make it a safe space for them to sing because you're not perfect.
Right. And I'm not palliative. I'm doing inpatient geriatrics. So this is typically with patients who have, and I'm using the term patients deliberately as opposed to people living with dementia. They are my patients. I am their doctor. If they have dementia, I'm trying to get them oriented, assessing delirium. Someone has Parkinson's. I want to help them produce louder sound. We just kind of weave it into the exam. And they sing along, and it's super fun. Try it.
Okay.
Theresa, how do you actually weave it in? What do you do?
Okay, so first I give a big apology to all of my friends in music therapy. I am not a music therapist. My degree is in musicology, technically music anthropology or ethnomusicologist. I am not a certified music therapist. A music therapist would use music deliberately to achieve a rehabilitation goal, just like a physical therapist or an occupational therapist. I'm a doctor. I'm just trying to get a better exam. And this gets called disparagingly music medicine, where doctors, because they have a license, they just use music like they would use a drug. But really, it can be as varied as someone who is afraid of the stethoscope and you get them singing with you and you slide the stethoscope on their back, and then at the end of the phrase, they go to catch their breath before the next phrase. Or someone with Parkinson's, where you say, have you done your Lee Silverman vocal training? Let's practice. And they say, come on, Eric, help me out here. Good. No.
No.
Yes.
Yes.
Do you enjoy this game?
No, because I'm terrible.
There you go. That's how you do it. Join me on rounds. It's so simple. It's just another tool.
And Tyler, that's why I loved your article at JGym on bringing music and benefits to patients at the bedside, the endearing approach, because if you're like me, music isn't medicine if I bring it into if I'm singing it. It's probably more like nails and chalkboards.
Not true. We've heard Eric sing on this podcast. Everybody should take a moment and listen to the podcast with Melissa Way, where the whole room sang Bohemian Rhapsody together. And it was perfect in every way, including pitch.
Oh, that's awesome. All right. Well, maybe Eric and I are being coy about our singing skills, but
no, not coy at all. And I loved in that article, on the JGym article, you start off with a story, Mr. A and Mozart. Can you tell us?
Absolutely. Yeah. Actually, Eric, I want to tell you actually about a different patient, if you don't mind, instead of Mr. A, because this is where the seed of the idea started for all this music for me. I'm originally an ER physician. I'd been doing ER medicine for over a decade when I went back to Palliative fellowship. And I found myself at times kind of at a standstill in rooms. I'm late in the afternoon with somebody, and I just can't connect with them. And I'm trying to have some kind of rapport and some kind of meaningful and I'm trying stories, I'm trying humor, I'm trying kindness, and nothing's happening. And I remember one day I was looking at this patient and I just thought, man, I swear this guy looks just like the old classic rock dude that taught me some guitar lessons when I was in middle school. So I'm just looking at him. I think we've been staring at each other for a couple minutes, and I just said, hey, can I play you a song on my phone? It was not very graceful. And he just goes, yeah, I guess. And I was like, I don't know, I'm going classic rock. He looks like an old rocker. And so I picked that song, The Boys Are Back in Town by Thin Lizzy, for no reason whatsoever. And I dialed it up and just pushed play. And it was like the lights came on. This guy came alive. It was beautiful. And he totally came out of his shell. He hadn't been talking to me all week. And we got all into like his family stuff and how he'd been suffering with cancer and his goal. I mean, it was beautiful. And I walked out of that room just thinking, oh my gosh, this is a tool. I had no idea. This is unlocking everything for this patient. And so as I went through fellowship, I just started messing around with it with patients, I wonder if this patient would enjoy hearing a song, if this patient would enjoy hearing a song. And with Greg Wallingford, my co-author on the paper, one of my attendings during fellowship, we got to the place where we were really comfortable. It just felt like a normal part of an encounter to bring up music and listen to a song with a patient. But then we thought, how is this a transferable skill? We got really comfortable with it.
Yeah.
So that's where that acronym, the endearing approach, kind of came out. We sort of thought about, what is it that we're doing? How could we tell somebody else to do this if they're less comfortable with it? And that's kind of how we came up with that strategy.
And can you tell our listeners, we'll have a link to the JGym paper, but can you briefly review what the endearing approach is?
Absolutely. And I'll say, just like any communication tool, this is a fallback position. It's a template, it's a starter. It's not, I don't go through all these steps every time.
Yeah.
But a lot of times how do we get into this topic? Well, the E in endearing stands for evidence. And so I'll say something like, we've been talking all about your pain and we're trying all these different medicines and trying to work with your anxiety. Did you know there's really good evidence that music actually helps your pain, or that music can help your anxiety? And patients are often like, that's interesting. And you say, yeah, actually, music that you like has been shown to really help. It can lower your pain score. And so they're, okay, cool. And then we normalize it. We're like, yeah, and actually, so it doesn't feel totally weird for them. We're like, yeah, we try to share music with all our patients. And like, oh, that's interesting. So I love that Jenny has been brave enough to ask patients their favorite song, because the letter D in endearing for me is a reflection of, I ran into roadblocks when I would ask patients their favorite song, because it was such an intimidating question. Like, what's your favorite movie? What's your favorite book? And they would freeze. So instead, I would just say something like, hey, what'd be a cool song to hear today? And so it kind of lowers the stakes, and it's like the song of the day. That's what the letter D stands for. And then the EA is just that stands for experience alternatives, which basically means you kind of don't know what's going to happen when you push play. So just kind of sit back and be ready for it. And I think that generally you experience whatever the patient needs. And sometimes it's a dance party in the ICU. Sometimes it's a sing-along. Sometimes it's reverent prayer and holding hands. And sometimes it's just kind of an opening up. And sometimes it's just quiet. So it really goes any direction. And then just the last letter in it of endear is repeat. Just encourage patients and families to bring music into their healthcare experience. And it has a great impact. So it's been a really fun thing to do with our patients. So
do patients like it? Like, does it go over well every time?
It's unbelievable. It is, I would say, here's the thing. It goes over well almost universally, because you're letting them guide it.
Yeah.
You're easing it. You're introducing it. I'm not, hey, you need to listen to Van Morrison, Madam George today. No, it's them steering it.
Do you have like a boom box that you're bringing in there? Like,
yeah, it's like the movie window? Say Anything.
Yeah.
I just stand like this, and play Peter Gabriel. No, I just put it on the phone and kind of hold it up near them, and a speaker would be nice. That would be a nice touch. But no, it really goes over well. And if you can tell that it's not, you can just kind of turn down the volume and start talking over it and just walk out,
Well, I did see a Dell News report on something that else you're doing, is you're actually wheeling a record player into people's rooms too. And
yes. Is
that different? That's not what you're doing on palliative care rounds. That's
right. No, you're right. That one's different. So the record player. So our inpatient hospitals are kind of under-resourced for music therapy. So we're sort of like thinking of what are some creative ways we can bring music to our patients. And we got this idea to have a record player on wheels on a cart and have a library of 50 records. And the idea with the record player is that it is it's in your face. It's a distraction. It's something that has no place in a hospital in most people's thinking. So it's like, well, this is odd. It just kind of takes you out of the sterile medical numbers and beeps and stuff environment. But what we do with it is we leave it in the room. We introduce it to families and patients and explain how it works and show them. And then we say, hey, you know what? This is yours. You drive. You flip through this. You find records that are meaningful to y'all, and y'all spin them. And we'll come get this from you in a couple hours and just let us know how it went. And that's been a really fun kind of it also is music, just like Jenny and Theresa, but it's what they're doing and what the smartphones are doing. But it's just a different medium. It's tactile and it's old school, and people really seem to enjoy that.
Do you clean the vinyls afterward? Like, how do you like? Because it's like a hospital. We have to worry about like decontamination and
absolutely. We do have to worry about cleaning. It is, and we obviously don't bring it into contact precaution rooms or other rooms. But and so we have, and we're sort of we have our volunteers are starting to take over ownership of this program. So we're kind of like building a team to help kind of maintain it, manage it, and make sure that everything's on the up and up with it. So
you've hit on something really interesting there with the vinyl. Not to like advertise my age, but just as one of the younger of the analog and the age of the digital.
Yeah.
A lot is lost in that transfer from analog to digital recording. And some of that was deliberate. We were excited when CDs came out and there was less hiss and there was better signal to noise ratio, right?
Right.
And then we were surprised when young folks started putting hiss back in and white noise became part of the music. But we know that music is a potent trigger of autobiographical memories and of nostalgia. We know that nostalgia reduces terror. We have good reason to link together a set of basic science studies along with what we know about life review to really believe that there is a potent, important role for music at the end of life to bring people together, to transmit legacy, all of these things. And if this is an older person who is used to hearing it on the record, their acoustic experience will be different on our smartphones. And I've had patients say, I don't like it when the music comes from your phone. And I've had a research participant buy a turntable just to get that experience back. So I think you've hit on something really important from an acoustic standpoint, and then bring into that the whole experience of lifting the record out of the sleeve, setting it on the turntable, putting the needle down, and you have this entire
that ritual
embodied experience that just like breaks down the whole hospital patient role. So
that's beautifully put.
I love it.
We should say,
wow, Theresa, that was awesome.
I should have put it in the intro. Theresa, in addition to being a geriatrician researcher, is an ethnomusicologist, like a PhD ethnomusicologist. So thank you for that insight, Theresa, into the history.
Yeah, sorry. I've been obsessing over this for decades. And now one of our new research participants, like I said, is a former radio show host, and he was going off on it. And the whole issue that we're now seeing where people have playlists, right? You just go into Sonos or Spotify and say cool jazz 60s and you get what you get, and you can skip it, right? But you can't listen to a whole album in the same way as you can with a vinyl or even CD.
Yeah.
Jenny, you had a question? Jump in here, Jenny.
I was curious if Theresa or Tyler or anyone here has heard of the Alive Inside documentary.
I'm such a nerd. I wrote the review for the journal.
Oh my, okay.
With Jenny.
What is this? What is this?
Tell me.
Tell us about Alive Inside, and we'll talk about the iPod project. Alex has written on it.
It's so amazing. So I got introduced to it when I was rotating through Connecticut Hospice here, and they were implementing that new program where you have patients who are agreeable with having iPods and listening to their favorite music. So I feel like this really goes hand in hand with what Tyler is bringing in. He's bringing in like a physical record player, but now also in hospice units as well, they're bringing out music players with headphones. But my concern with dementia patients was always it's hard and can feel a little bit suffocating to have headphones on your head. So I love the idea of having like a record player being wheeled in and having the music surround the entire room.
Yeah. What's Alive Inside?
Oh, it's literally a documentary of people following specific patients in nursing homes who benefit from music and seeing the impact of music. But Theresa has done a review, so I'm sure you could talk more about it.
Else, Theresa?
Well, we really should have Dan Cohen on the podcast. He's a social worker with an MBA who decided that he wanted to improve quality of life in nursing homes, and everyone deserved music, and went on this mission to bring then iPods, now MP3 players, to people in nursing homes across the country. Alive Inside is a documentary that was made of the process, and a YouTube clip of this man named Henry waking up in response to a song became just like viral on the internet. So it's a whole organization. You can find it at musicandmemory.org.
We'll have a link to it on our show notes.
You'll have a link to it on your show notes. It's lovely. And singing live at the bedside like Jenny is doing is lovely. And bringing in the record player. I mean, music engagement is not one thing. It's all of these things. And we all should be supporting one another's work. So, yeah.
Theresa, I totally agree. As I've done, as I've read the research, as I've talked to more people, I've become while I love the record player, I love this and that. I'm almost like a music universalist. I think all of us are, like, just get music in there however you can. It's like, if you got a record player, use that. If you've got a cello and know how to play it, do that.
Not a harp for Alex. Don't
no
put a
harp for Alex. No harp for Alex.
No, prayer bowl for Alex.
Yes.
Okay, I got to ask the question, though, is that you said there's really good research, Tyler, that it improves anxiety, I think, well-being, pain. Like, do we have like big randomized controlled trials showing that music improves pain, well-being, anxiety? Like, what do we mean by really good research?
Well, that is a great question, Eric. I think that it's probably not research on the level of statins or aspirin for MI or these sorts of things. There was you kind of have to find it. There was a really nice systematic review about 3 years ago in JPSM about various music interventions and pain scores in ICU patients. It was out of McGill University. And, they found that 20 to 30 minutes, this is, based on reviewing a number of studies, 20 to 30 minutes of patient preferred music could lower pain scores by 2 points.
That's actually better than most pain meds.
I know, exactly. So you then have to extrapolate from that, this record player has, I've never found a record player study or a smartphone. We did, so it's kind of a combination of, there are enough small studies, signs out there that this stuff helps and doesn't hurt. And then common sense and humanity kind of put it all together. I bet Theresa,
you're actually doing research on this, aren't you?
Exactly.
Yes. And before we do that, let's remember, for all of you who do I haven't done palliative care in years. I let my boards lapse a few years ago. But for those of you who do it, we always talk about risk and benefit. And even if the evidence for the benefit is small, there's zero risk of constipation, right? There's zero risk of pruritus. There's a small risk of wind-up. And we would be wise to listen to our music therapy colleagues about,
like, increasing agitate. What do you mean by wind up?
When you give an opioid and someone gets more pain instead of and you give more and it gets worse and you have to rotate the opioid.
So if I'm playing Tool for somebody, maybe that may wind them up. Well, Metallica.
Right. Eric, I have some.
Or if the song has associations with their trauma history.
Yeah.
Okay. And this is where I think you're hearing from both Tyler and Jenny what a lot of docs do intuitively, which is we ask, right? We ask, would you like to listen to music? What kind of music? What would you like? And I got to say, in, I guess, 20 years, has it been 20 years since you and I were fellows, Eric?
It's been 20 years. 20 years.
In 20 years, I have once seen somebody deliberately choose a song that was so traumatic, I had to actually put in my very first adverse event report. And I asked, why did you choose this? And was told, because it's important. And it's related to my current cognitive issues. But back to the point. Generally speaking, the risks of opioids are far greater than the risks of singing a song you like.
Yeah.
And tears can be therapeutic too. So even though this person was very upset, it was also, in their mind, helpful.
Yeah. And Tyler, you're going to say something? Go ahead.
Oh, I was gonna say, there's one of my favorite resources on this. There's a small book called Music and Creativity in Healthcare Settings, written by Hilary Moss. She's a music therapist out of Ireland.
Oh, she's amazing.
Isn't she amazing?
Oh my gosh. She has a new book coming out, but keep going.
Oh, good. But it's a really nice, it's about 6 or 7 chapters, and it's kind of like a nice little summary about, her experiences, but also her understanding of research. She quotes a lot of studies. So it's a good kind of starter for what's out there on this. But she does have a chapter called When Music Causes Harm. And essentially, it is kind of insisting on music when a patient doesn't want it, or playing triggering music for a patient. So it's sort of like it's kind of like if we insist on music in a certain way, that's when it can be harmful. If we're involving the family and the patient in the choices, I like Theresa saying the risk and benefit, it seems very low risk.
And Theresa, what do we know about music and dementia? So you've done some studies on this.
Without going on for 14 minutes and tanking your podcast. Music is relatively preserved in many kinds of dementia, particularly Alzheimer's. The ability to sing can remain after one has lost the ability to form sensible speech or has forgotten how to remember what they had for breakfast. Or even when people have like ADL, total care ADL needs, they will still occasionally sing. And in vascular dementia and Parkinson's, cognitive hits that affect your vocal production, also singing can be relatively spared. So we have all the beautiful things we've just talked about in terms of palliative care and the fact that someone who can't self-represent with words can still engage in music. So it can be very normalizing. One person told me it creates moments of great joy. You hear advertisements on the radio about how I got my mom back that day. And that's interesting inside, right? That people have what Andrea Gilmore-Bilkowski refers to as moments of lucidity.
Oh, we're recording a podcast. That's a terrific advertisement. Probably the next podcast that we release is on terminal lucidity, recording that.
But this isn't just terminal lucidity. In dementia, you have lucid moments throughout the process.
Yeah, lucidity.
It's fascinating.
What do you think the mechanism is in Alzheimer's, Theresa? What do you think that mechanism is that?
Oh, yeah. If I knew that, she wouldn't be doing all this research.
Oh, yeah. So we're still learning. But you've also done research on caregivers, too, and the engagement of music in caregivers.
Yeah, my studies are dyadic. So I'm really focused on, caregiving relationships are usually more complicated. There are lots of people involved, ideally. It's very hard to study those whole networks. So to begin with, I'm focusing on dyads of a person living with dementia and the care partner. In the earlier studies that I did with Alex, we were focused on people with moderate to end-stage dementia requiring 24/7 care at home. We made house calls. Alex has played the guitar for one of our participants.
Two,
correct. I forgot about, yes. Oh, I miss them. Anyways, the current study is looking at the impact of music on well-being after a new dementia diagnosis. And this has been really interesting because people are like, they just got their diagnosis. They're getting their PET CT and MRI scans so they can start lecanemab. I mean, it's so mild, that one IADL impairment. So it's totally different from what we were talking about before, where someone can't remember to speak, but they can remember to sing or respond to music.
I think when I'm taking care of my palliative care patients, I always check in on my patient's family. And nowadays with singing for my patients, I'm realizing the huge impact, and maybe even more so on the caregivers. So I love that you're doing that, Theresa. I remember when I was performing a patient's favorite song. It's a Christian song, and giving prayer for them as well from our lovely palliative care chaplain, Leah. We were singing and noticing the vital signs of the patient actually improving. And right before this, the caregiver kept interrupting her dad and saying, wake up, your saturations are low, your blood pressures are low. And every 10, 15 seconds, she kept looking at the vital monitor. And then once we started singing, his vitals improved, and she started closing her eyes and just sat with the music and stopped waking up her dad, who had such unrest. And I've gotten really close to that family. He passed away recently, but she was asking for me and the chaplain during his last moments, can they come in and sing?
Gosh.
And they do the same thing for us that they did for us last time. And because of that, I've actually been trying to do more research in caregiver support with music too. So would love to read more about what you do, Theresa.
Jenny, you're giving me chills over here. That was beautiful. Thank you. Oh my gosh.
And Jenny, how are you planning to involve music in once you're done with fellowship, in your clinical work?
That's a great question. I've been trying to think about that. Well, I think I'll continue. I'm going to be doing inpatient palliative medicine mainly. So I'll continue doing what I'm doing now. But I am planning on performing music outside of the hospital as well. You might see me on America's Got Talent. You might hear it first.
Whoa.
Yeah.
Wow.
Really?
And the producers reached out and they loved the story of having like a palliative care doctor performing for their patients. So you might see me on the TV screens
Awesome.
next
Oh,
year.
yeah.
This will be, we knew her when.
That's right.
Yeah. Before you have like the stay in the Sphere in Las Vegas performing every night. Theresa, I got to ask, what's next for you as far as this from a research perspective?
Well, so this is the beginning of a large longitudinal mixed method study. So we've recruited 25 dyads, like I said, really close to their diagnosis. The comment we've gotten from almost everybody with a new diagnosis at the end of spending an hour or two in their home was, well, this was fun. Seriously. Except for the person who said, this was exciting. And the person who cried who said, this was important. You're coming back. So we'll see them again at 3 months. We'll see them again at 6 months. We're recruiting to 100 dyads, so 200 people. We're looking at community-based organizations, and we're just going to keep synthesizing this to try and construct a picture of music in everyday life.
Oh, that's wonderful.
Incredible.
And Tyler, what's next for you with music and medicine?
Well, Eric, I'm excited. We're kind of organizing a volunteer corps, and it's a lot of pre-med students to work with our record player program at the hospital. Pre-meds love anything that combines their humanity and medicine, right?
Yeah.
Like, I want to be a doctor, but I don't want to give up on music or art or story.
And then internship takes the humanities straight out of us.
It takes it right out, exactly.
Or they're exposed to the specialty of palliative and become a palliative physician like me and like all of us.
Yeah. And then America's Got Talent star, Jenny Chen. Exactly. Yeah. So working on that. And
is that going to be, are they just dropping the record player off at someone's room, or are they actually sitting with them with the record player?
I think it depends on the case and it depends on the situation. There needs to be a sensitivity around it, of course. I think it'll be exciting for them to get some exposure to like patients and families in that situation, but also we want to make sure that, we're approaching these really delicate situations with sensitivity. So TBD a little bit on that. I'll report back, Eric.
Great. Well, I promised at the end of the day, we're going to do the final vinyl, what your final vinyl is. But then I realized after listening to Tyler, the endearing approach, which we'll have a link to in our show notes, maybe that's not the best thing that puts everybody on the spot. What's the song of the day? Jenny, what would your song of the day be today?
I would say Dream by Priscilla On.
Is there a reason why you picked that one?
Yes. It walks you through your life as a child, as a young aged adult, and then when you're close to the end of life. And it's one of the first songs I ever learned to perform for my patients, and I still do like 15 years later. So, yeah.
Great. Theresa, what's yours?
Oh, I've had David Wilcock's Rusty Old American Dream running through my head all day. So funny we have the dream connection going.
And Tyler, what would yours be?
Mine would be Where the Streets Have No Name, first song off of U2's Joshua Tree. So
great. Well, mine is actually going to be Thin Lizzy. The boys are back in town. That wasn't the song of the day. Alex, what is your song of the day that you're going to end us with?
We're going to do a little more Flaming Lips here. Do you realize that everyone you know someday will die? And instead of saying all of your goodbyes, let them know you realize that life goes fast. It's hard to make the good things last. You realize the sun doesn't go down. It's just an illusion caused by the world spinning round.
Theresa, Jenny, Tyler, thank you for joining us on this Jerry Pal podcast.
Thank you so much.
Thank you.
Thank you, Alex and Eric. What a pleasure.
And to all of our listeners, thank you very much for your continued support and joining us on this podcast. And we'd like to send a special thank you to all of the donors who've donated more than $250, including
Jeffrey Galbraith, Ron Sabar, Rebecca Goldstein, Anna Lynch, Deborah and Jeffrey Larson, Krista Masak, Ed Martin, Stuart Oserman, Mo Rizawi, Rochelle Bernacki, Daryl Owens, Mark Wren, Richard Lewis, John Bielenson, James Tulsky, Elizabeth Cobbs, Christopher Heck, Meg Walhagen, Chris Jones, Kate Mesrich, Jen Hopping, Ashad Abid, Michael Bordowski, Asher Edwards, Susan Nelson, Harry Hahn, Carol Heyman, Gretchen Schwarzy, Sharon Brangman, Elizabeth Chung, and Paul Amatelli.
Thank you very much for your support.